Hey everyone, this is Gabbi
and Karim,
and you're listening to the Making of an Incredible MD podcast by Allied to Health.
Tune in each week to hear us talk about the journey of getting into med school.
From GAMSAT to medical interviews, get the insider scoop from med students who have done it all before. So stay tuned and get ready to get med ready. Hello everyone and welcome back to the podcast. We are continuing on with our Learning in Medicine series today with an episode on LGBTQIA+ healthcare and advocacy. And I'm joined today by a special guest, Dr. Adan Sanchez. Hello, Dr. Adan Sanchez.
Hi, how are you?
Good, thank you. Before we jump into the episode, I will do an acknowledgement of country. So I would like to acknowledge the traditional and rightful owners of the land in which we are both on today. I myself am on Wiradjuri land, and Dr. Adan Sanchez, are you on Wurundjeri land of the Kulin Nations?
That's right, I'm currently in Kooyong, in the lands of the Wurundjeri people of the Kulin Nations.
Fantastic. So we'd like to acknowledge that the lands in which we are on always were and always will be Aboriginal lands. Okay, so Asiel, if you don't mind me calling you that, would you like to introduce yourself and tell the audience a little bit about yourself?
Of course. So my name is Asiel. I am currently a GP at Northside Clinic, which is a GP clinic with a specialist focus in LGBTQIA+ health. We really started with HIV management kind of in the 90s and early 2000s. And then as the LGBTQIA+ community has changed, I think nowadays we see a lot more transgender care more than anything else. But we encompass a lot of sexual health, gender-affirming care, endocrinological care, lots and lots of mental health. And do quite a lot of work in that space. It's a beautiful clinic to work in, very, very kind of close to community. On top of that, I do a bit of work to the board of Minus 18, which is a big LGBTQIA or youth organization. And we've been going on strong for about 20 years, and it's a really beautiful organization to work with. And again, kind of give back to the community. And last but not least, I am a published poet. I write in my spare time whenever there's a little bit of it. And I published my first poetry collection through Arena Ediciones earlier this year.
Wow, fantastic. You're very busy, but also have such a large scope of passions, which I love. And I'm sure poetry is a great escape from medicine as well.
Yes, definitely is. A lot of it was written, funnily enough, during kind of night shifts and just having a bit of quiet space. And I would go into the common room and then start scribbling down from there.
Wow, fantastic. And so I guess that sort of flows really nicely into the reason why you're on this podcast today. And that's because you really are an expert in this field of, LGBTQIA+ healthcare, as well as really advocacy, which I think is a really important topic that unfortunately as medical students, we don't really get that much teaching on. It is changing a bit, I will say. We are starting to get some lectures or some webinars, which are free and able for us to go to. But if other medical students are like myself, I'm always craving more teaching and more learning in this area. So that's really why we wanted to get you on, to have just a discussion about this topic at the level of, medical students or people coming into medicine or junior doctors as well. So really key information about the topic and key learnings and where we can learn more. So if we want to maybe start with sort of a bit of background information about this topic. So traditionally, what has sort of the healthcare experience been like for LGBTQIA+ communities? Great
question. Now, there's a lot of literature, both in Australia and overseas, that suggests it's not that great. LGBTQIA+ people over and over and over report having trouble accessing clinical spaces where they feel safe. They don't feel like their identity is either respected or validated, or in some instances, there's outright discrimination. The latest bit of data that's a little bit more Victorian specific, which is the 2017 population survey, and this was a population survey of all of Victoria, and they looked down and they broke down the data regarding LGBTQIA+ individuals specifically. They reported that they had experienced 32% of respondents had experienced discrimination in public settings, and a good chunk of it, or a large chunk of it, was in healthcare spaces. So that still tells us that there's a long way to go in the care that we provide. And certainly to me, accessing healthcare is just a basic human right, and we're trained in providing that basic human right, and that should be open to absolutely all people. So overall, the healthcare experiences are that it's a little bit inaccessible, it's really scary, and at times it can be outright discriminating.
Yeah, absolutely. It's sort of really hard to hear these things as well. And I think as a medical student, you can sort of feel quite hopeless when you hear these statistics. And that's really why this discussion, I think, is really important about how we as medical students can, be that small drop in this change to help ensure that change keeps going forward. And I guess with that, how has this experience changed over time for LGBTQIA plus communities?
Yeah, look, it has definitely gone a long way. Back when to kind of keep it in the scope of medicine and medical school, back when I started university, which was back in 2013 now, we didn't have absolutely anything on LGBTQIA plus health. And we kind of tried to make a big fuss about it. And there was literally one lecture on HIV in MD1. And that was it. That was like literally it. And it had one slide at the end that was like, lesbians exist. And that was completely it. And what makes me excited about kind of seeing change throughout, time and the new medical cohort that's been coming along is that I think medical education shifting quite a lot from having this expert base, you have to know every single management for every single condition, more towards a social advocacy kind of change. Which is really exciting because now we have so much repositories of knowledge. We have, ETG and all these other guidelines that we can look up. And we have, of course, the clinical experience that comes with time. But what we don't have and what we don't get taught so much is why is it important to actually just advocate for your patients? Like what's systemic violence? What's systemic discrimination? How can we even provide care when we can't even get our patient through the door, And I think a lot has changed, not only in the mindset of medical students and what they're coming to learn about, but their passion and their advocacy and their willingness to actually, stand up for their patients.
Yeah, absolutely. I definitely see that change as well coming through, which is, really positive. But in terms of actual improvements in the system, what do you think still needs to be made? Obviously, there's a lot, but narrowing it down to a few things, what are some key improvements that we can all work towards?
There's probably three key ones that we want to kind of keep in mind when we're moving towards the future. One of them is access to trans and gender-affirming care. As trans representation grows and as we become more aware of lived experience of different genders, accessing the required care is super, super important, particularly because we medicalize a lot of these gendered experience quite a lot. So, a lot of people that need to access gender-affirming hormone replacement therapy, for example, are on long waits around. So, for example, at Northside, we've closed our books since 2020 due to the pandemic, and we didn't have capacity to take on any more patients, which means that one clinic is down, and occasionally the handful of other clinics that can take on new, patients for gender-affirming hormone replacement therapy just dwindles down because they'll close on their books, they'll get really full really quickly, or the wait list just kind of balloons out to 18 months very, very easily. And at least my experience as a general practitioner is that general practitioners can and should be able to do it. It's not rocket science. It's something that just requires that understanding about that lived experience. And the medical side of things is also something that you can get support with an endocrinologist, something that you can kind of run by public clinics really easily, but you can manage the care without too much trouble. On top of that, just kind of basic language skills, basic affirming care, getting rid of things like, intake forms that have male and female and don't have any space for pronouns and don't have any space for actual names rather than the name that's on Medicare. So some of those systemic changes are very, very important. And we're still kind of lagging behind and trying to catch up in a lot of them. So transgender affirming care is definitely a huge chunk. Work around intersex health, I think, is also quite under-recognized and also very siloed as an extremely subspecialist kind of region. When in reality, I think we still need to challenge a lot of what it means to pathologize intersex bodies and how we treat intersex bodies around. And certainly the intersex community has worked for years and years and years and years to try and shift away from that kind of pathologizing model that we still hold up. So challenging kind of some of those understandings is also very important, and the treatment pathways that go along with it. And then probably the last one that I would say is understanding intersectionality a bit more. I think as I've learned around LGBTQIA plus health, I was always struck about how we had this kind of white Western lens over it, and we often didn't allow space for other lived experiences to really come on board. And on top of that, there's also a lot of neurodiversity that we're now starting to understand and kind of take in mind. There's certainly a big crossover between trans and neurodiverse people and neurodiverse community. And we always struggle to kind of bring those two together with a really kind of meaningful understanding. So that intersectional kind of approach, I think, is also something that's really lacking, not only in clinical spaces, but also in kind of wider society as a whole.
Yeah, absolutely. Those are some really important things, but things I think that are achievable at the same time. Well, I see as achievable anyway. Sort of backpedaling a little bit, just aware that some people might be early on in their medical career or early on at medical school and might not know sort of what gender affirming care is. So are you able to provide some context as to what it is and what it might involve?
Of course, that's a really great question. And you're right, I've been using a lot of terms like transgender diverse, gender affirming care, without necessarily providing context to those things. Gender affirming care essentially means a lens over medical practice that really respects, values, and validates someone's gender identity, regardless of what that might be. And I think the way that we talk about it in the media, there's perhaps some misunderstanding of what that actually implies. But reality is kind of taking the person that's in front of you, knowing what gender they might identify as, if they're comfortable sharing that, and kind of tailoring your clinical practice alongside to it. So, for example, for someone who is transgender diverse, that might involve asking their pronouns and making sure that that's recorded appropriately, that that's reflected in the referrals, if they wish to share it with whoever we're referring to. That we are able to change the name on Medicare, for example, if that's not their actual name, and again, making sure that that's reflected in any correspondence that we do. Unfortunately, there are some limits still. So, for example, scripts absolutely need to have the name that's on Medicare, and I always apologize and they say, look, it's a thing, we know it's a thing, we just kind of get on with it. And similarly, pathology slips, radiology slips, kind of any of those referrals that are kind of linked through Medicare need the Medicare name on top. But otherwise, in your clinical practice, referring to their correct name, the correct pronouns, asking, for example, if there's any preferred terms for body parts, if you're examining a relevant region. So the most common one, of course, is reproductive genital region. And just starting by asking, oh, look, are there any terms that you'd like me to use? Are there any terms that you'd like me to avoid? And they'll tell you, and it'll be like, okay, great. I'm going to use, I don't know, for example, front hole instead of vagina. That's because that particular term is what that patient prefers. And sometimes they might not. I also have had patients that are like, no, look, vagina is fine. I'm completely fine with it. I love my vagina. Great, fantastic. So you're guided very much by what the patient is comfortable with. So all it really is patient-centered care, basically. And it's just providing this gender lens over it. What it's not is completely erasing gender out of clinical practice, which I think lots of people get the impression that, gender radicals want to just degender everything. And we really don't. It really becomes about cultural literacy and cultural competence. And for example, knowing that if you have a cisgender woman in front of you, you might not need to ask all those questions. And they will perhaps, in fact, be a little bit confronted if you ask, are there any terms that you'd like me to use around it? Or they might not necessarily understand it. Similarly, if there's someone who just doesn't kind of fall within that demographic, you might not necessarily need to ask all those questions around because it's not particularly relevant to that patient population. And again, I have to acknowledge the learnings from a lot of Aboriginal Torres Strait Islander educators that have done a lot of work in the cultural competency space and that have informed a lot of the principles that we use in kind of gender inclusive practice. So similarly, you might not necessarily have that cultural lens if someone is not Aboriginal Torres Strait Islander, but if someone is, you will then put on your kind of cultural competency hat and use those skills to kind of navigate patient-centered care with that particular patient. So similar to that, gender-affirming care is taking that gender lens over patient-centered care and that interaction that you have.
Yeah, absolutely. I think you described that really well, and in a very sort of non-confronting way. And I like how you sort of differentiated the fact that, no, it's not taking gender out of the picture. We do have this gendered lens on, and, you know, keeping that in your mind is really important, I think. And you've really touched on some things that I think scare students a lot when we're talking about this topic in terms of language. You know, how to ask questions in, you know, a sensitive way, but also in a way that, you know, gets the answers so that then you can practice patient-centered care. So I guess one of those questions is asking about pronouns. And I think you're right when you said before that sometimes if you have a cisgendered person, they may not know why you're asking and they might get a little bit uncomfortable. And I think that's the most sort of challenging part of this, but then also wanting to ask everyone as well, because it's important that we ask everyone. So how do you think we go about asking questions like, what are your pronouns and why is it important?
Yeah. And again, another really great question that also baffles medical students and clinical educators, actually. I've also gotten a lot of clinical educators going, how do I navigate this pronoun thing? And in reality, the easiest solution would be systemic change. And what I mean by that is to have an intake form that just has that included in it. So for example, at Northside Clinic, we do have an intake form that says, you know, pronouns blank, and the patients fill it in. So by the time we get to the patients, I'm like, okay, well, your pronouns are he, him. Is that okay to record in the system? Yes, everyone in the clinic will know what pronouns that person uses, including reception. So when they're talking to patients over the phone, they know to use they, them, he, him, you know, she, her, or whatever else. Unfortunately, a lot of hospital systems absolutely don't have that. And it's a big complex topic in and of itself. Changing hospital forms takes a long, painful, tedious process to do. And on top of that, updating electronic medical records, which are now used in a lot of hospitals, can also be incredibly challenging. So there's a lot of barriers for big hospital systems, a bit less so for smaller community-based kind of clinics around. So to me, that's probably the easiest option. The patient is able to tell you, self-describe before they even get through the door. It just makes everything else so much more smoother. You don't need to kind of navigate those questions. You don't even necessarily need to think about it. You just need to be aware of it. In the case that doesn't happen, and I appreciate medical students are in that particular hard category where not only might they not get access to the full medical record, but might not necessarily have the time to actually look into the EMR before kind of the consultant says the history of this patient. You're like, in terms of navigating that on a clinical interaction, I'm very much a fan of just letting things flow kind of naturally. So if someone hasn't disclosed their pronouns on the intake form, or if someone just hasn't disclosed their pronouns throughout, I'll probably ask it when we get to their social history, once I've had a chance to build rapport and get to know them a bit more, and, you know, ask who are you living with, what do you do for work, are there any pronouns that you'd like for me to use? And by that stage, we've at least built some rapport so it doesn't come off as confrontational. But again, I understand that's a very precious privilege that I have as a GP to take kind of a bit more time in that initial consult with a one-to-one discussion with a patient. Less so for the busy medical student who's talking to someone in ED or trying to do a long case and trying to kind of navigate all of these things around. The other option is to essentially include it as part of your general practice around. Similar to how we include Aboriginal Torres Strait Islander questions when we're taking clinical history, including questions about are there any pronouns that you'd like me to use throughout this interview. At the top, nice, straightforward, easy around. if you don't feel comfortable just getting to that level just yet, another way of flagging that you're someone who's safe to disclose pronouns to is just introducing yourself with the pronoun at the beginning. So, my name is Asiel, my pronouns are they, them. I'm a medical student at the University of Melbourne. I've been asked to take a history from you. Is that okay? And then off you go. At least that tells this particular person, okay, well, this person is aware that there are at least pronouns exist, and that if my pronouns are something different than what people assume, I can correct them or I can kind of bring it up with them. Similarly, if there's any instances where you are going to be referring to a person's kind of pronoun, just checking in with them. I'm going to discuss this with my consultant. Are there any pronouns that you'd like me to use to refer to you? Great, fantastic. We can just kind of tick that box. So again, there's probably a lot of different ways of doing it, which for medical students I know is the worst piece of advice, because then they get nervous about which way is the best and which way to go. The best would definitely be systemic change. Something nice and easy that you can incorporate from the get-go is just introducing yourself with your pronouns, and that way people can know that you're at least someone that they can disclose their pronouns to. And of course, including that question at the very top of your interview and saying, are there any pronouns that you'd like me to use? Can also be kind of part of the routine, and probably what we're heading into in terms of clinical interviewing skills and what will come across in the future.
Yeah, absolutely. And I like that there's so many options as well, because, as students, I think the best way is to just practice. And then you feel, more comfortable going forward. So trialing a few different methods and a few different orders to your history taking may be really great as well. And something that the UniMelb MD Queer Society did last year was they ordered sort of like little badges that we can wear next to our name badges with our pronouns on them. So I think that's really great, because it's sort of like a visual representation of, something that says, these are my pronouns. I'm going to ask you what your pronouns are, because it's important to me, and I hope that, it's important to you too. So it's that sort of visual check as well, and sort of like, I don't know, just a flag to sort of say, yeah, this is something I believe in and something that I care about, which I think makes it easier as well.
Yeah, absolutely. And patients will certainly notice, for people who are transgender diverse, it's already such a heightened environment, particularly to be in hospital. Like, clinics are already a little bit challenging. Hospitals, there's absolutely no transgender diverse patient that I know that is like, yeah, I had a great experience at the hospital. It's always already kind of a hyper-aware, hyper-anxious environment. So those little flags to say, okay, this is at least a safe person that I can talk to, can actually make a big difference. And you might be the one person in the hospital that they're like, okay, I can at least talk to the medical student, and I hope that the medical student can kind of advocate for me. That can actually create a big impact. So I would certainly not say that the pronoun question is definitely something that can make a tangible impact in that person's health journey as they're navigating through that healthcare system.
Absolutely. And it's just something that's so not time consuming at all. It's so quick and so easy to do. So if we can start doing that, and everyone can start doing that, and it's just starting that waterfall for change a little bit, isn't it?
That's right, yeah.
And going on from that as well, you've touched on it previously about talking about anatomy. And this is something that I think is probably above medical student level, because we often, we might be engaging with conversations about patients of, future direction or their pathologies or, management of something. But especially probably year 3 level, when medical students are getting into parallel consulting in GP clinics, that's probably the most relevant time. When talking about sort of health screening, I think that's the most important part. So things like cervical screening tests, mammograms, all of these things which are related to the reproductive system and reproductive organs. Sort of how do we open this conversation with transgender patients or gender diverse patients about these really important screening tools without knowing sort of how they might react, or the best way about going into discussions about these things?
Yep. And again, if you're in general practice, that provides a nice little safe little cushioning around, because you can bring those up without being too confronting and in a room full of people around. But probably, obviously, the most important thing is de-gendering sex, if that kind of makes sense. And to provide a little bit of context about what I mean, we don't say the female lungs or the female heart or the male brain. Well, some people might say the male brain, I don't know. But there's no kind of anatomical basis under that gendering of that particular body part. Your hand doesn't have a gender. But for some reason, well, throughout history, we've taken this very gendered lens in sexual and reproductive organs. So breasts suddenly become gendered, and penis suddenly becomes gendered, and cervixes usually become gendered around. When in reality, they're just another part of anatomy. And at the same time, we unfortunately don't have a lot of language to degender those anatomical parts. So there's no way of, so for example, if I say that the female reproductive anatomy, everybody knows what that means. But I don't have a kind of a degendered or a non-gendered or a gender neutral way of saying those collection of body parts or that collection of anatomy without putting that gendered lens on it. So it's a lot of challenges, even to that kind of granular level of the discourse, where we just don't have the language to express sexual and reproductive anatomy in a way that's not gendered. And again, I think that's another frontier for another time around it, and certainly beyond the scope of this particular chat. But in the way that kind of impacts patient care is that when we talk about those gendered body parts, we do have to be a little bit mindful of how to navigate that conversation. The best way, and again, it requires kind of a few layers to it, the best way to navigate it is to have that gender-affirming lens on when we talk about reproductive screening, particularly when it comes to sexual and reproductive health. And again, the key question that I have is, are there any particular body parts that you'd like me to, are there any particular terms that you'd like me to use for that body part? And the patient, again, will tell you. Most people are pretty okay with standard screening. If there's a cervix present, we just have to make sure that there's screening done every 5 years, and this will involve a speculum and taking a little swab of the cervix around. Is that something that you'd be interested in? Or is that something that someone has chatted to you before? Because again, some people, because they pass as a gender that's not assumed to have a cervix, they might not even have flagged it. And we certainly have patients that have been, on the cervical screening list. It just kind of fell off the radar and no one has done it for more than it should be recommended. Similarly, if there's any tissue left around the chest or the breast region, depending on, again, what terms the patient prefers, chatting to them about doing screening for that particular area. And as you can tell, it becomes a little bit about dancing around those gender terms. So practice is definitely the best way of doing it. So for example, if someone prefers chest region instead of breast region, using those specific terms, if not a general kind of chest area, something that's gender neutral until kind of you have that language that the patient prefers is the best way to do it. At Northside Clinic, we have a pretty clear system to disclose whether or not this patient has cervix, for example, and when the next cervical screening test is due. So when they pop into the clinic for whatever reason, we can be like, oh, hey, just so you know, the cervical screening thing is coming up. Is that something that we can help facilitate around? And in terms of actually doing it, that's when, again, that gender-affirming care lens comes on, asking specifically what terms they'd like us to use, explaining the procedure inside and out so that the particular patient has a really clear understanding of what's going to happen, and making sure that's a lot of safety netting and aftercare. So if you'd like me to stop at any stage, if you'd like to debrief, if you'd like to make sure that you feel okay afterwards and we're not inducing any gender dysphoria, we can have a chat about it as well. So in terms of working with transgender diverse patients in particular, it does take a bit more time, and it does take a little bit more kind of care to make sure that that person's okay. So elements of kind of trauma-informed care can be really, really useful in this particular area. They're the same principles that I use with someone who's, for example, experienced sexual assault and might have a very traumatic experience around something like a cervical screening test, and just making sure that we're doing a really safe environment for it. So I guess it's a little bit of that mix in terms of asking the patient for their preferred language and using those terms, and incorporating some of that trauma-informed care, because unfortunately a lot of transgender people have had a lot of trauma around gendered kind of body parts. And a lot of transgender diverse people have also experienced a lot of sexual assault as well. We know that from kind of the statistics, they're overrepresented in that particular set of experiences. So having those kind of trauma-informed skills also kind of goes a long way.
Yeah, absolutely. And I think that is something as well that medical schools are getting better at as well, is, incorporating trauma-informed care into different sort of talks or lenses as well, which makes it a little bit easier, but it's always going to be hard. And, changing the way that we speak in a regular conversation can be a really long adjustment, and medical students might feel awkward. I definitely feel awkward sometimes when I sort of stutter on my words to make sure that I get the correct terms out. If medical students do sort of stuff up and accidentally say the wrong thing or accidentally misgender someone, what is the best steps to go after you've made that mistake to ensure that, the patient doctor / medical student relationship isn't too broken, the patient doesn't feel, too upset or sort of, uncomfortable in this medical environment? How can we sort of overcome that or sort of remend that relationship?
Yeah, look, it's unfortunately a lot of transgender diverse patients are in a way almost used to it. So in whenever they come in and have that medical interaction, there's almost already an expectation that, oh God, something's going to happen along the way here, then I'm just going to get misgendered, or the correct term is going to be used, or my gender is going to be invalidated in some way, shape, or form. And most people are almost used to kind of having that little barrier around them. In terms of navigating it as a medical student, I think being really upfront about the fact that you're still new to a lot of this language and just saying, hey, look, I'm still learning about gender-affirming care. I'd really like to try my best. If I stuff up at any stage, let me know. And at that stage, even if you are fumbling with your words, or even if you make a mistake here or there, that patient will go, oh, actually, at least this person is really trying. And I know they're a medical student, and I know with practice, they will actually get better. So that little mistake actually becomes a learning moment for them. So instead of kind of having that negative cloud over it, we all acknowledge, hey, this is a learning space. And believe it or not, transgender diverse people are happy to kind of have those learning moments with them, because they acknowledge that part of the problem is the fact that doctors don't get training on them. So if there's an opportunity for those skills to be improved and they're happy to share some of that learning and language environment, 100% we can just kind of move on from that little interaction around. And again, it might actually be a positive interaction, because they can see that you're really, really trying to be gender affirming in the best way that you can. If you continue to mess up around it, or if you feel like the patient is just in a more vulnerable position and is not in a space to actually go through some of those kind of interactions, the best way to do it is, if they correct you, say thanks. If you misgender someone and they go, oh, actually, it's they, them, or she, her, or whatever else, say thank you. My apologies. I'm gonna use they, them from now on. Actually, it doesn't even need to be that complicated. Say thanks for correcting me, they, them, and then move on. What I disencourage a lot of people from doing is kind of making a bigger deal out of it than what it needs to be, and apologizing over and over for a little kind of slip up, because it then puts the onus on the patient to be like, no, it's okay, it's fine, I do this all the time, it's okay, really, it's okay. And then that kind of takes over the interaction, rather than a little kind of misstep that might have happened. It's very, very similar to, for example, forgetting someone's name, and you just call them Bob instead of Charles or whatever else. And they go like, oh, actually, it's Charles. And you're like, oh, thank you, Charles. Moving on, rather than becoming it a big thing around what is perhaps a little misstep, and getting back to the actual clinical interaction. Of course, the problem becomes when the student or the clinician just completely ignores those signals and continues to misgender the patient and continues to use dead names instead of the actual name of the person. And that's when it can become really confronting, and that's when the therapeutic relationship will probably suffer as a result. But again, as a medical student, I can reassure you that if you have that kind of humility to say, oh, look, I'm really just learning about this gender-affirming care, I might not have the correct language or the right tools yet, but please feel free to correct me if I misstep, and I'm going to try my hardest today. Is that okay to continue? Patients will be like, great, here's a doctor that's trying really hard. Here's a doctor that's going to be a gender-affirming clinician when they grow up. It's great. Let's just kind of get on with it. It might be the first time that someone has actually disclosed that to them or made that big of an effort to have a safe interaction with, transgender diverse patient. So that cultural humility is also very, very important in terms of gender affirming care.
Yeah, absolutely. I think that's really good advice. And yeah, just knowing that medical students, like you will make mistakes, and it's probably going to happen, but ensuring that you stay humble and stay sort of motivated to keep trying and keep ensuring that you're learning more every day, and sort of just improving on these skills, you will get more confident over time and feel sort of less awkward about all of this. Just like when first doing your first patient history, doesn't matter if it was chest pain or what it was, it's always awkward in the beginning, not knowing how to really talk to patients. It's the same thing, just practice.
Yeah, absolutely. And I think what you get more comfortable as a doctor is the fact that you just don't know anything, and the fact that you can just navigate those interactions with a little bit more cultural humility, and it's okay.
Yeah, absolutely. And I guess that goes really nicely into the next step, and it's sort of, what are some key resources for learning for medical students to really ensure that they're feeling comfortable when going into clinical scenarios? You spoke before about Minus 18 as an organisation that you work with. I know that's a great resource. Are you able to provide some more context about that organisation?
Of course. So Minus 18 is a big LGBTQIA plus youth charity. We essentially do three main pillars of work with young LGBTQI plus young people. One of them is social connectedness. So we might have events and formals and just social spaces for people to come together and make friends and have that community connection around. I've been watching a lot of Heartstopper recently, and it just kind of struck me as that vibe, of just having someone to talk to and making that connection and making you feel like you have friends and you have community, which for a young person that's just coming out can be so vital and so important. I really see it as almost suicide prevention, because we know from again the research that you have at least 5 people that care about you and are connected to you, your risk of social isolation, depression, suicide just kind of drops. And I think that social connectedness pillar is certainly kind of part of it. We also do workshops and training, and this is largely more focused towards school, workplaces, more of that kind of corporate vibe, where people just want to be more affirming in their space. Schools, again, is a big one, and the workshops that the team does are incredible. They're super fun, super accessible, and just break down these concepts and ideas in a really accessible kind of way around it. And again, to me, that's also part of mental health prevention. If you have a school that is supportive, it can make such a big, big, big difference. Certainly, over the last few months, I've kind of picked up a few more young trans patients, and really to have the school behind them can make a world of difference in how they feel about themselves and how their gender affirmation goes. So that's kind of a huge, huge aspect. And the other one is visibility. And similarly to social connectedness, if you see yourself represented and visible in a really positive way, I think, unfortunately, a lot of LGBTQIA plus community and representation can sometimes focus on the challenges, the trauma, the history around it, and don't leave a lot of space for kind of queer joy. And I think what Minus does really, really well is show the fact that it's super cool to be young and LGBTQIA plus, and we have this beautiful community behind you, and really kind of portray that through social media, through campaigns, through activations around. So kind of those are kind of 3 big pillars around. It's a very good stop for introductory resources. Again, a lot of them are aimed at young people who are just thinking about their gender or their sexuality and just kind of want to explore a bit more. So it has that kind of youth lens on it. But if you want a place to start that's super easily accessible, that's got a lot of fun resources to look at, the website is fantastic. And again, there's a lot of free resources in there that that students can dip into. Similar to that, another project that Minus did in conjunction with an organization called White Gender is a series of videos called Trans 101. That one I would certainly recommend for medical students. it's just a breakdown of a lot of nuances of being trans and gender diverse, and it goes from anything to pronouns to intersectionality to mental health in a very youth-driven, transgender diverse kind of focus. And again, they're super accessible videos. They're kind of things that you can put in the background and listen to while you're doing other stuff that you can kind of sit down and watch. They're very engaging and very well done. So I would 100% recommend Trans 101. It has that little bit of an educational lens on top while still being super, super duper accessible. And if you want to learn a little bit more about the clinical side of things, there's probably a couple of resources that I would suggest. One of them is Wavelength. I think the proper link is wavelengthmeded.org.au. They're a specific resource for medical students that have lecture series, that have kind of clinical scenarios, the ones that you would do in CST, but working with LGBTQIA plus patients. So they might have sexual histories, mental health histories, gender-affirming histories. How do you ask someone about their gender if they're in that initial kind of journey, in a way that's, again, tailor-made specifically for medical students. That particular website is about to be updated as well. So kind of mid-year, a new wave of videos, resources, lectures, they're kind of going to come out from that particular website. So I'm really excited to see what comes out of it because it's well overdue for an update. The other resource, and the last one that I would probably flag, is the Primary Health Network, the Northwestern Primary Health Network, Trans and Gender Affirming Care kind of package. So I think if you Google essentially PHN, transgender diverse, it'll come up. This was done by Dr. Ruth McNair, who is one of the other GPs at our clinics, also incredibly knowledgeable in this space, and really led a lot of the work for informed consent, trans and gender affirming care, and has been in this space for a very long time. It is geared a little bit more towards GPs, so it has more of that granular detail around. But if someone, for example, if someone's from community and you know all the trans affirming care stuff from your clinical practice or from lived experience, someone who has a bit more of that kind of lived experience, I suppose, that's where you can look to see, okay, what's the actual options for hormone affirmation? What do I need to know about in terms of making blood tests, in terms of management, in terms of monitoring? It has some of that really nitty-gritty granular detail. I know we focus a lot in medical schools about the clinical skills, but the other bit that often gets obscured is just even knowing what like hormone affirmation looks like, and even knowing what kind of options there are for trans and diverse people and some of the barriers that can come across with it. So that particular package covers all of those elements in really great detail. Again, probably a little bit above medical school, but if you're interested in it, it is a very fantastic, very accessible, very easy to do kind of resource.
Fantastic. Thank you so much. I'll list all of those resources in our show notes as well to make it really easy for listeners, and you can sort of choose what level you'd like to sort of research into all of this content. So thank you so much for all of those resources. And I guess going on from that, the reason why we're wanting to learn and wanting to, take advantage of all of these resources is because we want to be good advocates for patients. And I guess my question is, how do we advocate for patients on a personal, patient level in, for example, the hospital setting? If, our consultant or our teachers are maybe doing, gender unsafe practices or, misgendering patients or, there's some unsafe practice happening. How do we, get the courage to stand up for patients and advocate for them?
Yeah, this is a really challenging question, particularly because there's so many variables and particularly because the hospital system is so big. As a medical student, you're really confronting to kind of bring those up. The first thing that I would suggest is, making sure that you feel actually comfortable in taking on that particular subject, and not necessarily comfortable in the sense that, I'm going to know everything about transgender diverse care because you don't have to, but comfortable in the sense that you actually feel safe and supported by the medical school or by the hospital to bring these discussions into light. Again, being a medical student, I know what it's like to kind of go through a surgical ward round and this particular, surgeon is just powering through it and there's just no time to have those discussions. And if you bring it up, the whole thing's going to be like, why are you talking right now? And then knowing what pathways there are for you to actually provide some of that feedback. So the first thing that I would say is just be mindful that then and there, right at that moment when, the consultant or the surgeon or whoever else misgenders a patient or is just using the incorrect language, might not be the best time to actually bring it up, because hospital systems are big and complex, and that might escalate things more than actually help solve the problem. So it might be a matter of taking notice, being aware that that's happened, and providing feedback through either the medical school or through the hospital around it. And again, hospital systems are probably a bit of a different beast, and it can be difficult finding what particular pathway to do. But being aware that it's happened and being able to provide that feedback can then trigger on a series of roll-on effects that it can be like, oh, actually, yes, we don't really have anywhere to record pronouns. What do we do about it? And that in itself can start moving kind of more systemic change. It can be really hard to change a doctor's practice right then and there because, we spent like an hour talking about this stuff at a medical student level, and someone who's a little bit more senior, who's kind of a little bit more set in their ways, might not necessarily either have the time or capacity to really go through that gender-affirming practice stuff unless some systemic change happens. And, the college tells them, or the hospital tells them, this is something that we have to do in order to provide safe care. In medical school or in smaller clinical placements, it can be a little bit easier because you have that closer one-on-one rapport, or you might have a bit more time to discuss it with a clinician. GP practice being kind of the perfect example, where, if you notice something happens around, a really good non-confrontational way would be to ask them about, do you look after a lot of transgender patients? Tell me a little bit more about that. Or, you notice they are using the wrong pronouns. A simple question like, oh, I noticed that this person's pronouns were, they, them instead of she, her. Do we have a way of recording that in the practice software? So something that's really non-confronting, that asks about a broader question rather than kind of put blame on that clinician and say, you did this wrong, which I highly doubt any clinician will respond really well to. Is probably the best way of kind of navigating those things. And certainly from other medical students that I've talked about, those little kind of innocuous questions, which can actually just be honest general questions. This particular student wanted to know more about transgender affirming care, and the GP was like, actually, I don't know much about it, and I have a couple of patients. Maybe I should upskill. Maybe we should have a kind of a clinic-wide chat about it, or a clinical presentation about it. That can promote that further thinking and further learning around. So I suppose that while I said, be a bit mindful about whether or not the space is the correct space for you to give that feedback, the feedback that medical students give can lead to wider systemic change, wider education, wider thinking about some of these kind of issues around. So don't shy away from giving some of that feedback. Just make sure that you do it in a way that's kind of structured, that you're safeguarded by the institution that you're working in, being it hospital, being it medical school, being it kind of a GP practice around, and making sure that you feel kind of comfortable and safe enough to actually give that feedback.
Yeah, absolutely. And I think it is a lot of leaning on peers as well, asking peers, what have you done in these situations? Because we've all, been in sort of uncomfortable situations with seniors, and how we've navigated that, and learning from each other, I think, is really important. And going on from that, obviously doing all of these advocacy on a personal level, asking the questions, being well informed, all of these things, if we do it individually, will lead to systemic change. But is there anything else that you think, medical students should keep in mind when looking into the future of LGBTQIA plus healthcare?
Yeah, I suppose in terms of not necessarily looking into the future, but looking into the present a bit more, we talk a lot about safety in patient care and safety in clinical practice. The other thing to be mindful about is that there's already lots of transgender diverse doctors and medical students around. So that kind of affirming care, being mindful of someone's pronouns and the language that you use, is also safe for your peers and just kind of can make a big difference in how someone's medical school journey can be. So there's definitely a lot of a growing network of LGBTQIA plus practitioners that are around that do a lot of really fantastic work. And keeping in mind that it's not only safe in the clinical environment, and the language that you use is not only going to impact patients, but it's also going to impact the peers and colleagues that are around you. And in a way, if a colleague also sees that you're standing up for some of these patients, they can be like, that person's amazing, we should probably be friends, and talk to them about it. So it can make a big, big difference for sure. In terms of kind of moving towards the future, and this is more of a wish list than anything else, I really kind of want to see more of that change almost at a Medicare kind of level, and making sure that gender-affirming hormone, for example, is covered by Medicare rather than out of pocket. Gender-affirming surgeries are covered by Medicare rather than out of pocket. There are 10,000 surgeries that people have to pay up that are people that are already marginalized, that people that face a lot of systemic barriers in getting jobs and financial support and financial access. So that would be the next kind of best thing that I would definitely see. And most importantly, I'm excited about essentially the medical students that are going through now, finishing up and being these really wonderful clinicians that, regardless of what specialty they end into, they have at least that awareness and that learning in mind. And that's why I think teaching this stuff in medical schools and talking to medical students is so important, because regardless of where you end up, you'll have those kind of tools to navigate it and really advocate for patients. And a big role that I see as a general practitioner is very much being an advocate for my patient and writing the pronouns in the referrals and calling people up when they write back to me and saying the incorrect pronouns or the incorrect names, and helping navigate what is a very complex medical system with my patients. So long story short, I'm excited for y'all and what y'all going to achieve when you graduate. It's going to be amazing.
Yes, thank you so much, Asiel. I've learnt so much this morning, so much. And just having these conversations and listening to experts like yourself, I think is so, so important. And, as you've said, do your best. Every patient experience is, one step closer to you feeling more confident, and for you being able to have the skills to really care for patients in a patient-centered way, which is ultimately, and at the end of the day, what we all want to do. So thank you so much for sharing your knowledge and wisdom with us all. I'm very grateful. And if anyone has any feedback or any questions about this episode, please let me know, and I'll pass those questions on to yourself. But thank you so much for joining me today and having a chat.
Thank you for having me. It's been an absolute pleasure.
Thank you for listening to the Making of an Incredible MD podcast by Allied to Health. Please like, share, and subscribe to help spread the word about our podcast. And we'd love to hear your feedback. So send us an email or message on Facebook. All of our links are in the show notes. Thanks. We'll see you next time.